Welcome to another edition of Ask Dr. George, and today it's wisdom teeth.
That's right. That's right. A lot of people have to have their wisdom teeth out.
Why?
Well, it really depends. Not everybody needs to have their wisdom teeth out. So what we do is when we see, a lot of times it's teenagers and people in the early 20s. Sometimes later they may have been left.
Right.
And then they develop problems later on. But generally we catch them at a fairly young age. And what we're looking for is, first of all, are they going to have room for those wisdom teeth?
Right. Believe it or not, I was told that this wasn't big enough to house them. And when I had them done, I was put out in the hospital.
Yeah.
And honestly, for me, it was the best experience ever. How do we go about with the sedation?
Yeah, so basically what happens is once we've decided that somebody needs to have their wisdom teeth out. So here I've got a radiograph up on the screen here. And what happens is that, some people are in this kind of situation.
That one's sideways there.
Yeah, so you look here and you can see this one is completely sideways.
Wow.
And the one above it, because this tooth hasn't come in, is dropped down. Like you can see how the height of where the rest of the teeth are, and then this guy's dropped down. Same thing's happening on the left side here. This is dropped down, this one's on an angle. And what happens is if we don't get those teeth out of there, then what you'll see is they'll start to develop a cavity on the adjacent tooth underneath the gum line.
Okay.
And here what you can see is that there's a little bit of bone loss here. And anyways, this person was getting recurring infections in the back of his mouth because this one peak of this wisdom tooth had poked through. And so it was allowing bacteria to get underneath that gum, and it was continuously getting infected. So this is a pretty extreme case, but we see teeth like this all the time that are lying down, that haven't come in. There's no room for them to come in. They're never going to come in. And the other thing that can happen is sometimes people will develop a cyst around the head of this tooth. So there's a lot of reasons why we have to have wisdom teeth removed for people. And so what we do then is the first thing that we want to do is we want to make sure that we can remove those teeth safely.
Right.
So you asked me about sedation.
Right, because I'm hoping gone are the days where the foot and the pulling and all that business, because people get scared about that.
Yeah, people have these images in their mind of somebody with their knee on their chest.
Exactly.
Pulling, trying to get the tooth out.
But no more, right?
No more.
Okay.
And, it's funny, I've actually heard stories like that. I had one patient, an elderly patient, and she told me what it was like when she was a child.
Right.
And a one-room dental office in the country, and no anesthetic.
Right.
Yeah, and pretty horrific stories. So anyways, things have changed. We can take care of those things very well. So one of the biggest risks that we have with wisdom teeth removal, especially with the lower wisdom teeth, is that there's a nerve that runs, I don't know if you can see this.
Okay.
Right here. You see this little dark spot?
Right.
And you see it's like a line running right down here. And you can see there's another line over here. So the one on the right side over here is running along the root tips. Do you see that?
Right.
Right in here?
Okay, yeah.
Okay. Whereas this one is running sort of along the midsection.
Okay.
Okay. And you can see there's two roots here. Okay. So when we see something like this, we start getting a little bit worried because that nerve may be coming right down the center of those two roots. And when this tooth is removed, it's possible to cause damage to that nerve.
Right.
And so that's one of the biggest risks of having wisdom teeth out, is that you could end up with a paresthesia on the lower jaw. And so if that nerve is damaged, that feeling that you have when you've had freezing or anesthetic.
Right. Yes.
And you know how your lip feels all tingly and numb. Well, in a situation like this gentleman here is at a very high risk for having a permanent paresthesia if that nerve gets damaged.
Right.
And so we need more information than just this two-dimensional x-ray here that we have here. This is called a panoramic x-ray. And so this is the one that we do as a screening shot.
Okay.
To sort of get an idea where the nerve is sitting relative to the teeth, to see how the teeth are sitting in the jaw, all of that information. But it doesn't give us the whole picture. It's missing that third dimension, where's the nerve running, this way. Is it on this side of the tooth? Is it on that side of the tooth? Is it running through the roots?
Okay.
We don't know what's going on here, so we need a little bit more information before we're going to do this procedure. So in a situation like this, we'll actually do a CAT scan. And so one of the technologies that we have here at my office is we actually have a dental CT scanner.
Okay.
And we can do three-dimensional x-rays. So I'll show you what that looks like here. So the one we were most interested in was the lower left wisdom tooth. So if you take a look here, this is the tooth. And now what we can do is we can actually see this in 3 dimensions. Wow. And yeah, so you can
That's
see,
cool.
yeah, so you can see how this tooth is actually lying here. It's lying slightly out to the side.
Yeah.
And the crown of the tooth is sort of tucking in this way, and the roots are coming out to the cheek.
Right.
And so what we wanted to see is where's the nerve. So we can trace that nerve out, and we can see exactly where it's running. And if you look carefully here, you can see that the nerve is actually kind of running towards the outside of this tooth.
And that's kind of what you want, right? That's kind of ideal.
It's better than running right between the roots. And
Yes.
we can actually turn this around in all dimensions to see exactly where that nerve is lying. And so what we now can do, generally, you know, people like to see the 3D picture, but most of us and most of the doctors, we will look at a series of 2-dimensional pictures taken from all angles, which is what a CT scan does. So I can move out of this view, and now we're looking at it in a different view here. So we can move. So if you look at this photograph over here on the left,
right,
you can see, so this is this view here, this yellow line.
Yep.
So we're looking at what we call a tangential view, and you can see where the nerve is running here. This is a cross section, so that's this line. And then we have a third view, which is this way.
Right.
Okay, and that's what we're looking at here. So it's a horizontal slice. It's this one. Okay, so the screen is nice. It puts all the 3 planes of view in there for us, and then this is our panoramic shot here. So that's sort of like what we were looking at before. So we can see where the nerve is sitting. Here's the 2 roots, 1, 2, and the nerve is kind of running beside it here. So when this patient was in for surgery, the way that the surgery would be done is, first of all, the top of the tooth is removed.
Okay.
And now we then go in here and separate the 2 roots. And now we can then take those 2 roots out individually.
I see. So it's kind of a lift and separate for the teeth.
Exactly. Exactly. So, you know, typically we're not going to, you know, you can imagine trying to take this tooth out. You know, the path it wants to go is this way.
Yeah.
And it's running into this tooth, so there's no way to do it. So when we talk about doing a wisdom tooth surgically, usually we have to first of all get access to the area because it might be partially buried, and then we have to remove that tooth, and so the tooth needs to come out and, you know, and be dissected and removed. And so typically there's a number of things that we'll do with respect to that. Now, getting back to your earlier question about sedation.
Yeah.
That's something, I kind of went on a tangent there.
It's all good.
Yeah, but sedation, everybody, you know, obviously this is a little bit involved of a procedure, and not everybody wants to be, you know, awake and aware of all the noises and the stuff that's going on. So typically today, there's a number of ways we can sedate people. You know, you could have nitrous oxide sedation, which is very light, like laughing gas. You can have oral sedation, which is where we give you a medication just as a pill.
Okay.
It's not that effective. We'll do another video on sedation so that we can get into this in more detail. Then there's intravenous sedation, which is kind of like what you would have for a colonoscopy or something like that. And then there's general anesthetic.
Yes.
And so, unfortunately, you know, wisdom teeth in the past, our intravenous sedation techniques weren't that great in the past. And so they used to use general anesthetic all the time on these procedures. The problem with general anesthetic, it has its pros and cons, but one of the problems with it is that, you know, it's so deep of an anesthesia that basically they're in effect turning you off. You can't breathe on your own anymore. You know, you have a machine breathing for you. You have to be intubated. It can be done in the hospital. Oftentimes it's done in an oral surgeon's office and they bring in an anesthesiologist as well. But it's a very, very deep sedation. It's what they need to do. You know, you can imagine if you're having heart surgery or something.
Yeah.
Well, there's no way they can put a little local freezing in there and freeze everything up and then split you open. So they have to basically turn you down so deep that you won't feel it when they open you up.
Yeah.
So with dentistry, however, we don't need to do that.
Okay.
Because we have good local anesthesia. We can take care of the pain issue with our anesthetics. And then all we really need to do is take care of anxiety.
Yeah.
And so intravenous sedation is a great way to go. It's a lot safer. You're breathing on your own. You don't have to be intubated. And so I think intravenous sedation is probably the way the profession has turned to in the last number of years. And, I think it's a much safer way to have your wisdom teeth removed.
Right.
There may be a few occasions where a general anesthetic is necessary, but I think most of the time it's really not necessary. It's overkill.
It would have to be extreme, right?
Yeah, I think it's overkill for what we're doing. You know, intravenous sedation is probably, or general anesthetic might be best left for people who would be uncooperative to be able to, work them even with IV. And so, so that's kind of wisdom teeth in a nutshell. Any other questions? What else would you like to know?
Well, I'm wondering how many people out there are actually walking around with these things?
With wisdom teeth?
Because they were clearly there for a reason.
Yeah.
So are there people still that have them, I guess?
Yeah, there's lots of people that still have their wisdom teeth. Certainly if we don't see problems, if there's no cyst developing, if the teeth, have come in and there's space, not everybody has room for them.
Right.
And so, we try to identify early which ones are going to need to be removed, so that, when a tooth is developing, it develops the crown of the tooth first.
Okay.
And then it grows its roots.
Like a tree.
Yeah.
Okay.
So if what we can do is if we can catch it before the roots develop, so around 15, 16, years old, if we can catch it before the roots have developed, then obviously it's a much easier procedure because I don't have big roots to deal with. And there's less chance of having paresthesia because we don't have those roots.
Exactly.
So,
right.
if there's no roots there and it's just a crown, then oftentimes these teeth can be removed quite simply.
Okay.
And we already have an idea when the crown is developing. If you take a look at this tooth here, we would have been able to see when this crown was developing that it was developing on a 45-degree angle, and we would know that this tooth is probably not going to come in.
He's a problem, that guy. We knew he was a problem, yeah.
Yeah, he didn't get caught for whatever reason. He came to us, in his 20s, and we're seeing this, and he's having problems, so he needed to have that tooth out.
Okay, great.
And so that's kind of the situation there. So the other thing that we do oftentimes with these is we use what we call platelet-rich fibrin. We'll do another video on that and what that is, but it's using the body. We take a blood draw from the patient, we spin it in a centrifuge, and we create a platelet-filled fibrin clot that helps stimulate the healing.
Okay.
And so we can place those into the sockets, close it all up. Post-operatively, people are going to heal differently. Sometimes people have a lot of pain. You've probably known people who have to sit on the couch for 3 days with some Tylenol 3s.
And lots of swelling.
Yeah, get a lot of swelling. But often, not always is it going to be like that. Sometimes people have them out and don't have any issues at all. So it varies from person to person. But in general, we tell people to expect to have a day or two off and just get caught up on their Netflix and sit at home and relax until everything heals up.
But that's no reason just to come and get your wisdom teeth out, just to sit around and watch Netflix. Well, thank you, Dr. George. This has been great. And of course, wisdom teeth. Wisdom or not wisdom? I guess it's up to you.